7 common medications that can be harmful to your kidneys. Avoid overuse. In today's world, medications have become a part of daily life. They can help alleviate symptoms, treat illnesses, and improve quality of life. But they can also pose serious risks, especially if not used correctly. One of the silent dangers associated with medications is kidney damage. As we grow older, our kidneys naturally begin to lose some of their functionality, making it even more critical to protect them from excessive exposure to harmful chemicals and medications. Managing kidney health becomes increasingly challenging with age, as many people develop health conditions that require multiple medications. However, some of these drugs are nephrotoxic, meaning they have the potential to cause harm to the kidneys directly or indirectly. This can result in a decline in the kidney's ability to filter waste from the blood, leading to a dangerous buildup of harmful substances in the body. If left untreated, this can lead to serious complications. The extent of kidney damage can vary, ranging from mild impairment to complete kidney failure. Drug-induced nephrotoxicity, the kidney damage caused by medications, becomes more likely as people age and develop kidney issues. There are 2 main types of kidney damage related to medications: dose-dependent toxicity, where the harm increases with higher doses, and idiosyncratic toxicity, which is unpredictable and varies from person to person. In cases of dose-dependent toxicity, higher amounts of the medication increase the likelihood of kidney damage. Conversely, idiosyncratic toxicity can affect individuals in unpredictable ways, meaning that some people may experience kidney damage from medications that others tolerate well. In certain situations, it may be best to avoid certain medications entirely. Drug-induced kidney damage can result from conditions such as rhabdomyolysis, the breakdown of muscle tissue, renal infarction, death of kidney tissue, or renal tubular acidosis, an accumulation of acid in the body. These conditions can severely reduce kidney function and may also lead to other serious health problems such as nephrotic syndrome and electrolyte imbalances. In this article, we will explore the effects that common medications can have on kidney health and offer practical advice for managing these drugs responsibly. By understanding the risks associated with certain medications, you can make informed decisions about your treatment and reduce the potential for kidney-related complications. It's important to note that this content is created by humans for humans. We do not rely on AI-generated tools to automatically produce content. So you can trust that all our information is carefully fact-checked and reviewed by medical professionals. Now, let's dive into the medications that can harm your kidneys and what you should watch out for. 7. Antibiotics. Antibiotics are among the most commonly prescribed medications, but they are not without risk, especially to the kidneys. If your doctor prescribes antibiotics for conditions like a sore throat, skin infection, or another bacterial infection, you should be aware of the potential harm they could cause to your kidneys. First, let's clarify what antibiotics are. Antibiotics, also known as antibacterials or antimicrobials, are medications designed to fight bacterial infections by either killing the bacteria or inhibiting their ability to reproduce. Some commonly prescribed antibiotics include Cipro, Augmentin, Flagyl, Bactrim, and amoxicillin. These medications are frequently used to treat conditions like strep throat, pneumonia, urinary tract infections, UTIs, and skin infections. While antibiotics are effective in treating bacterial infections, they are not effective against viral infections, such as the common cold, the flu, bronchitis, and most cases of cough or sore throat. Overprescribing or improper use of antibiotics can not only lead to side effects like diarrhea, but can also cause liver and kidney problems, even when taken as directed. Certain antibiotics, including polymyxins, aminoglycosides, and vancomycin, are known to have nephrotoxic effects, potentially harming your kidneys. The kidneys play a crucial role in filtering out antibiotics and other substances from the body. However, antibiotics like polymyxins can damage the membranes of kidney cells, leading to kidney injury. Similarly, aminoglycosides can build up in kidney cells, causing cell death and harming the tubules of the kidneys, which are essential for filtering waste. The exact way antibiotics cause kidney injury is still not fully understood, but inflammation and cellular damage are likely involved. To use antibiotics safely and minimize the risk of kidney damage, it is important to follow your doctor's instructions carefully. It is also worth noting that nearly 1/3 of all antibiotics prescribed in the United States are unnecessary. According to the Centers for Disease Control and Prevention, CDC, and a study published in the Journal of the American Medical Association, before requesting or accepting an antibiotic prescription, it's a good idea to ask your doctor if it is truly necessary. Most doctors are happy to explain why they are recommending a particular treatment. If antibiotics are prescribed, take them exactly as directed, and do not skip doses or save any leftover medication for future use. Antibiotics are prescribed based on individual health needs, and sharing them with others can be harmful. If you are enjoying this information so far, don't forget to show your support by liking the content. This helps us create more educational material like this. 6. Nonsteroidal anti-inflammatory drugs, NSAIDs. Nonsteroidal anti-inflammatory drugs, or NSAIDs, may sound unfamiliar to some people by that name, but many of us are quite familiar with popular medications like ibuprofen, aspirin, Motrin, ketorolac, celecoxib, and naproxen. These are all types of NSAIDs, and many can be purchased without a prescription. NSAIDs are some of the most widely used medications, with more than 30 million people around the world taking them daily to relieve various types of pain and inflammation. NSAIDs are commonly used to alleviate headaches, sprains, strains, and to reduce the aches and pains associated with the cold and flu, as well as manage more chronic pain conditions such as arthritis. The way these medications work is by blocking the action of an enzyme called cyclooxygenase, COX, which helps produce substances that cause pain and inflammation in the body. However, COX also plays a vital role in protecting the kidneys during times of stress and helps regulate the excretion of sodium and water. As a result, when NSAIDs block the COX enzyme, they can inadvertently harm the kidneys, leading to significant concerns. In fact, all NSAIDs have the potential to cause acute kidney injury, AKI, especially when used in high doses or over long periods. And this risk is particularly elevated in older adults. There are two primary ways in which NSAIDs can damage the kidneys. One is by altering blood flow to the kidneys, and the other is by causing inflammation. Both of these outcomes stem from the inhibition of the COX enzyme. The first issue arises when NSAIDs block COX, causing the blood vessels in the kidneys to narrow, which reduces blood flow to these vital organs. This reduced blood flow can lead to a series of problems, including fluid retention, high blood pressure, and mild but temporary kidney impairment. If this reduced blood flow is not addressed, it can eventually lead to more severe complications, such as acute tubular necrosis, where kidney tubules begin to die due to a lack of oxygen, potentially causing acute kidney failure. Although this initial kidney impairment can seem reversible at first, the damage may progress over time, eventually leading to chronic kidney disease, CKD. Secondly, while NSAIDs are known for their anti-inflammatory properties, prolonged use can actually lead to inflammation in the kidney tubules, the small structures in the kidneys that are responsible for filtering waste from the blood. Although this kind of inflammation is relatively rare, it is still a significant concern. Overall, kidney issues caused by NSAIDs affect 1% to 5% of daily users globally, which translates to between 500,000 and 2.5 million people worldwide experiencing some form of NSAID-related kidney injury each year. The risks posed by NSAIDs extend beyond kidney injury. These medications are often involved in hospital admissions due to adverse drug events, some of which can be life-threatening. A 2006 study published in the Journal of the American Society of Nephrology analyzed data from 10.184 patients who had been prescribed NSAIDs for various conditions. The study found that NSAID use increased the risk of acute kidney injury, AKI, by 26%, with the highest risk occurring within the first 30 days of starting NSAID treatment. This highlights the need for caution when using these medications, especially over extended periods. In another study, researchers followed 99 patients with chronic musculoskeletal pain who had taken NSAIDs for 12 months. The study found that most patients experienced a decrease in kidney function after prolonged NSAID use. But their kidney function returned to normal after switching to alternative pain-relieving medications. This demonstrates that although the kidneys can sometimes recover after NSAID use is stopped, the damage caused by long-term use can be significant. For those interested in further exploring the evidence, numerous studies support these findings, and the studies are linked in the description of our source materials. This evidence clearly shows that while NSAIDs are effective in managing pain and inflammation, they come with serious risks, particularly concerning kidney health. Therefore, patients and doctors alike must use caution when prescribing or taking these medications, particularly over long periods or in high doses. 5. Diuretics. Diuretics are another class of medications that are commonly used to treat fluid retention or swelling, conditions often seen in individuals with heart failure, kidney failure, and liver cirrhosis. While some diuretics can be purchased over the counter, most are available by prescription and are typically stronger. Common diuretics include hydrochlorothiazide, HCTZ, bumetanide, marketed as Bumex, furosemide, sold as Lasix, spironolactone, found in aldactone, and acetazolamide, in Diamox. These medications work by increasing the production of urine, helping the body eliminate excess fluid and salt. Diuretics are also often prescribed to help with high blood pressure, hypertension, a leading risk factor for kidney disease. By increasing urine output, diuretics help lower blood pressure by reducing the amount of fluid and salt in the body. As such, they are generally considered beneficial for kidney health, as they help manage conditions that could otherwise place a heavy strain on the kidneys. However, despite the benefits diuretics provide, they are not without their own risks, particularly concerning kidney function. While diuretics don't directly damage the kidneys or interfere with the filtering function like NSAIDs do, they can alter the concentration and composition of the urine by increasing the amount of fluid excreted or changing the balance of electrolytes in the urine. If used in high doses or for extended periods, this can lead to dehydration, which is a significant risk factor for kidney damage. A study that examined 131 patients who had used diuretics and suffered from acute kidney injury between 1999 and 2010 found that 96.2% of the patients had at least one existing health issue before starting diuretics, with chronic kidney disease, CKD, being the most common, found in 55% of the cases. The study also discovered that patients taking diuretics were more likely to develop kidney disease and its associated risk factors, such as hypertension and diabetes. Moreover, approximately 27.5% of the cases of acute kidney injury were caused solely by diuretic use, while the remaining cases were due to a combination of diuretics and other drugs. This highlights the importance of consulting a doctor before starting new medications, especially for people with CKD or other underlying health conditions. For individuals with chronic kidney disease who are taking diuretics, it's crucial to stay well hydrated and have regular checkups to monitor electrolyte levels and kidney function. Fortunately, there are now more options than ever before for home testing, allowing people to monitor their kidney function from the comfort of their own homes, ensuring early detection of potential problems before they become serious. This expanded explanation provides a more comprehensive understanding of the potential risks associated with NSAIDs and diuretics, particularly in relation to kidney health. 4. Proton pump inhibitors, PPIs. Proton pump inhibitors, PPIs, are some of the most commonly used medications available over the counter, and they are widely used to manage digestive conditions. These drugs are particularly effective for treating conditions like gastroesophageal reflux disease, GERD, acid reflux, and peptic ulcers by reducing the production of stomach acid. The way PPIs work is by targeting an enzyme in the stomach known as H+K+ ATPase, or the proton pump, which plays a critical role in the secretion of stomach acid. While PPIs are highly effective in providing relief from uncomfortable acid-related symptoms such as heartburn and acid indigestion, there are risks associated with their use, particularly for your kidneys. One of the most significant concerns is the potential link between long-term PPI use and acute interstitial nephritis, AIN. a kidney disorder characterized by inflammation in the spaces between the kidney tubules. Although only a small percentage of people who take PPIs develop AIN. These medications have become one of the leading causes of drug-induced AIN in developed countries. What's more concerning is that AIN caused by PPIs often shows no obvious symptoms and can go unnoticed for a long period. As a result, long-term PPI use can gradually lower kidney function and may lead to sudden acute kidney injury, ACI. If left untreated, this damage can progress over time, potentially leading to chronic kidney disease, CKD. An additional side effect of prolonged PPI use that is often overlooked is hypomagnesemia, or low magnesium levels in the blood, which has also been linked to CKD. Hypomagnesemia can disrupt the delicate balance of electrolytes in the body, leading to inflammation and contributing to the development of kidney disease. Low magnesium levels can also cause other serious health issues, including muscle spasms, seizures, and irregular heartbeats. A significant 2019 cohort study published in the Journal of Pharmacotherapy explored the impact of PPIs on kidney health by investigating the relationship between PPI use and new cases of acute kidney injury, ACI, and chronic kidney disease, CKD. The study, which examined data from a large group of 93.335 individuals, found that those who used PPIs had a 4.35 times higher risk of developing ACI compared to those who did not take PPIs. Similarly, PPI use was also associated with an increased risk of CKD. Another group of 84.600 participants in the same study showed that those taking PPIs were 1.2 times more likely to develop CKD compared to non-users. These findings underscore the importance of regular monitoring for anyone taking PPIs, particularly over an extended period. It is crucial for patients to have routine checkups to monitor kidney function and magnesium levels while using these medications. This evidence serves as a reminder that while PPIs can be incredibly effective in relieving acid-related discomfort, long-term use should be approached with caution. It's essential to avoid letting the treatment of one health issue create new problems elsewhere. Particularly with your kidneys, kidney health is often neglected, but it's vital to recognize how various medications, including PPIs, can contribute to kidney damage over time. Beyond kidney risks, extended PPI use can also lead to other serious health problems, such as nutritional deficiencies, bone fractures, and an increased susceptibility to infections like Clostridium difficile. These side effects occur because reduced stomach acid production can interfere with the body's ability to absorb certain nutrients, such as calcium, magnesium, and vitamin B12. This, in turn, can weaken bones and immune defenses. As a result, it's generally recommended to take PPIs for the shortest duration necessary to manage acid-related conditions and minimize the risk of adverse effects. 3. ACE inhibitors. Angiotensin-converting enzyme, ACE, inhibitors are prescription medications widely used to lower blood pressure and manage conditions related to the heart, blood vessels, and kidneys. Some of the most common ACE inhibitors include lisinopril, marketed as Zestrol or Prinavol, ramipril, found in Altase, enalapril, in Vasotec, and benazepril, in Lotinsin. These drugs work by blocking an enzyme responsible for producing angiotensin II, a hormone that causes blood vessels to narrow and increases blood pressure. By inhibiting this enzyme, ACE inhibitors help relax blood vessels, which in turn lowers blood pressure and reduces strain on the heart. In addition to lowering blood pressure, ACE inhibitors play an important role in protecting kidney health, particularly for individuals with conditions like chronic kidney disease, CKD, or diabetes. By improving blood flow to the kidneys and reducing the pressure within the tiny filtering units called glomeruli, ACE inhibitors help preserve kidney function over the long term. These medications are also effective in reducing the presence of protein in the urine, a common issue in individuals with kidney disease, which can further help protect the kidneys from long-term damage. However, while ACE inhibitors provide several benefits for kidney health, they are not without risks. For example, combining ACE inhibitors with other medications such as NSAIDs or diuretics can increase the risk of developing acute kidney injury, ACI. Additionally, People who don't drink enough water while taking ACE inhibitors may also be at a higher risk of ACE. Another common concern about ACE inhibitors is their potential impact on the estimated glomerular filtration rate, eGFR, a measure of how well your kidneys are filtering waste from the blood. Although a higher eGFR is usually associated with better kidney function, ACE inhibitors may cause a slight drop in eGFR. This is not necessarily a sign of kidney damage. Instead, it reflects the relaxation of the glomeruli as ACE inhibitors reduce the pressure within the kidneys. However, in some cases, the eGFR may drop too much, particularly in individuals with heart failure, severe dehydration, or blockages in both renal arteries. If this happens, doctors may need to adjust the dosage or temporarily stop the medication to determine the cause. In rare cases, ACE inhibitors can lead to acute renal failure, particularly in patients with conditions like heart failure, diabetes, or CKD. However, most patients recover fully after stopping the medication, even if they require temporary dialysis. Despite these risks, ACE inhibitors are often highly beneficial for patients with kidney disease or heart conditions. When used appropriately, they can help protect the kidneys and prevent further damage. To minimize the risks, it's important to take ACE inhibitors under close medical supervision, with regular monitoring of kidney function and electrolyte levels. This expanded version offers a deeper explanation of the mechanisms, risks, and studies behind the use of PPIs and ACE inhibitors. 2. Antiviral drugs. While most viral infections clear up on their own without requiring antiviral treatment, doctors often prescribe antiviral drugs for more severe or long-lasting infections, including conditions such as COVID-19, Ebola, influenza, genital herpes, hepatitis B and C, and HIV. These medications are effective in managing symptoms and reducing the severity of viral infections. For instance, in cases of the flu, two common antiviral medications are oseltamivir, Tamiflu, and zanamivir, Relenza. These drugs help clear the infection from the body, speeding up recovery. However, when it comes to chronic infections like HIV, hepatitis, and herpes, antiviral drugs are not able to completely cure the disease. Instead, they serve to manage the symptoms and reduce the viral load in the body, thus improving the patient's quality of life and preventing complications. Despite their numerous benefits in treating viral infections, antiviral drugs can pose significant risks, particularly concerning the kidneys. This risk comes from either direct toxicity or the formation of crystals in the kidneys, which can lead to kidney stones and other serious complications. Careful management and close monitoring are essential for people with pre-existing kidney conditions to prevent harm. One example is remdesivir, a drug that gained attention for its emergency use in treating COVID-19. Remdesivir contains a compound known as SBECD, which is primarily filtered out of the body by the kidneys. In individuals with kidney problems, SBECD can accumulate, leading to potential kidney toxicity. Although some clinical trials have reported a decline in kidney function among patients taking remdesivir, the results have been inconsistent. Additionally, data collected from global sources indicated a noticeable increase in cases of acute kidney failure associated with remdesivir compared to other COVID-19 medications. Despite these findings, there is still a need for larger-scale studies to definitively determine the safety of remdesivir for patients with kidney issues. Beyond remdesivir, other antiviral medications frequently used to treat viral infections can also contribute to drug-induced acute kidney injury. For example, drugs like cidofovir, adefovir, foscarnet, acyclovir, interferon, and tenofovir can directly damage kidney cells by reducing blood flow to the kidneys or increasing the concentration of toxins. This condition, known as acute tubular necrosis, occurs when kidney cells begin to die off, impairing kidney function. Furthermore, certain antiviral drugs, such as atazanavir, can cause inflammation in the kidney's interstitial tissue, further damaging kidney function. Medications like acyclovir, indinavir, and foscarnet have been known to cause crystal formation in the kidneys, leading to blockages in the kidney tubules, which can worsen kidney damage. On the other hand, some antiviral medications, such as Vareed and foscarnet, while useful in managing viral infections, also carry a heightened risk of causing kidney failure if not closely monitored. Due to these risks, it is vital that antiviral medications be taken under strict medical supervision, especially in individuals with kidney concerns. Doctors must carefully monitor kidney function and adjust treatments as needed to safeguard kidney health. Patients are also advised never to skip doses or take their antiviral medications inconsistently, as doing so may cause the virus to adapt and become resistant to the treatment. This phenomenon, known as antiviral resistance, can significantly reduce the effectiveness of the drug. Additionally, antiviral drugs are only available through prescription, so it's important to avoid purchasing them online or from unauthorized sources. Proper medical guidance is essential to ensure both the effectiveness of the treatment and the safety of the patient, particularly when kidney health is a concern. This extended explanation highlights the important balance between the benefits and risks associated with antiviral drugs, especially for those with pre-existing kidney conditions, and emphasizes the importance of medical supervision during treatment. 1. Lithium. Lithium is a prescription medication widely used to treat certain mental health disorders, particularly as a mood stabilizer. It is often prescribed for conditions such as mania, characterized by extreme excitement, hyperactivity, or distraction, and bipolar disorder, which involves dramatic mood swings between emotional highs, mania, and lows, depression. Common brand names of lithium include Priadel, Camcolet, Lisconam, and Lee Liquid. For over 6 decades, lithium has been a lifeline for people struggling with bipolar disorder, helping to stabilize their mood and enhance their quality of life. While lithium has proven to be highly effective in managing mood disorders, its impact on the kidneys should not be overlooked. Prolonged use of lithium can lead to various kidney-related issues, ranging from acute and chronic kidney disease to the development of kidney cysts. The risk of kidney damage increases the longer a person takes lithium. And while early signs of kidney impairment may be reversible, permanent damage can occur if the condition is left untreated. One of the most significant kidney issues associated with lithium use is a condition known as nephrogenic diabetes insipidus, NDI. Unlike the more common forms of diabetes linked to high blood sugar, NDI occurs when the kidneys become less responsive to a hormone called antidiuretic hormone, ADH, which helps regulate fluid balance in the body. As a result, patients may experience excessive thirst and the need for frequent urination, especially during the night. Over time, this condition can worsen, potentially leading to end-stage renal disease, ESRD, a severe and life-threatening form of kidney failure. Some of the early warning signs that lithium may be affecting the kidneys include an increase in urine output, excessive thirst, frequent nighttime urination, and dehydration symptoms such as low blood pressure and a rapid heartbeat. In extreme cases, lithium toxicity can also cause changes in mental status, including confusion or disorientation. Additionally, lithium can cause the kidneys to excrete too much sodium, resulting in a condition known as hyponatremia. This condition occurs when sodium levels in the body drop rapidly, sometimes within 48 hours, which can trigger serious health complications, including muscle breakdown, rhabdomyolysis, severe confusion, seizures, coma, and even death if left untreated. Given these risks, it is crucial for patients taking lithium to maintain a balanced diet that includes an adequate amount of salt and fluids. This helps prevent electrolyte imbalances and other complications. Regular blood tests are also essential, particularly to monitor creatinine levels, which indicate kidney function. Adjustments to the dosage may be necessary over time, and it is important to consult a healthcare provider if any unusual symptoms arise. Lithium has the potential to cause harm not only to the kidneys but also to other organs and systems in the body. Therefore, it is important to inform your doctor about any pre-existing health conditions, especially if you have issues related to the kidneys, heart, thyroid, or breathing, or if you have conditions such as Addison's disease or Brugada syndrome. Special care and close monitoring are required to minimize the risks associated with lithium use. Extra tips for safe use of lithium. If you suspect that lithium is affecting your kidney health, seek medical advice immediately. Kidney failure symptoms may not be noticeable at first, but as the condition progresses, signs such as reduced urine output, swelling in the legs, shortness of breath, and extreme fatigue can become more prominent. If left untreated, these symptoms can lead to life-threatening complications. Therefore, it is vital to stay vigilant about your kidney health while taking lithium and to undergo regular tests, such as checking glomerular filtration rate, GFR, blood creatinine levels, and urine analysis. Patients taking lithium should also be aware of potential drug interactions. Sharing a comprehensive list of all current medications with healthcare providers is critical to avoid harmful interactions that could worsen kidney function. Many drugs, including antibiotics, NSAIDs, diuretics, proton pump inhibitors, ACE inhibitors, antiviral drugs, and lithium, can negatively impact the kidneys in various ways, such as by causing direct toxicity, affecting renal blood flow, or leading to electrolyte imbalances. Therefore, those with existing kidney disease or a predisposition to kidney issues should work closely with healthcare providers to adjust dosages and minimize risks. A healthy lifestyle can also help reduce the reliance on medications. Eating a balanced diet rich in lean proteins, fruits, and vegetables, along with regular exercise, can protect the kidneys from potential damage. For those serious about maintaining kidney health, regular monitoring and proactive management of risk factors are essential. In summary, lithium can be an incredibly effective treatment for mood disorders, but its long-term use requires careful management, especially regarding kidney health. Staying informed, undergoing regular testing, and working closely with healthcare providers can help mitigate the risks while maximizing the benefits of lithium treatment.